treatment is pretty close to the same. Like a specific phobia, for example, if the individual could tolerate it, you would use an exposure therapy where you would gradually expose the person to it, either through using imagination. Say you're afraid of snakes, maybe have you imagine a snake while doing a relaxation technique. Then move it towards having a snake maybe in an aquarium in the room, and maybe having that aquarium of the snake on the lap while doing relaxation techniques, and finally maybe petting the snake. That's an exposure therapy. For someone that can't tolerate that, just imagining it getting closer and closer and closer while using a relaxation technique. General anxiety is a little bit different. There's nothing that the person identifies as a trigger for anxiety, so you would probably do a cognitive behavioral therapy, and that would involve journaling. And they would have the individual pay attention to whatever events seem to trigger the anxiety, and then have the individual pay attention to what the automatic thoughts were. And then in therapy, they would bring in those the journal and the automatic thoughts, and I would train them to figure out ways to correct the thoughts that are usually irrational, and take the intensity of anxiety and jack it way up and bring it down to where it probably really belongs at. I have actually a handful of people that come in for panic disorder right now, currently on my caseload. The treatment again is cognitive and behavioral. The problem with anxiety medication is that it's highly addictive. The person, once they are dependent upon that to manage their anxiety, to come off of it, you have to have some sort of skills in place to be able to do that effectively, and then it's got to be monitored by a physician, and people usually come off of it gradually. The fastest answer for helping a person not be anxious is to have that individual confront whatever the fear is that they have as early as possible. And if it's thoughts or beliefs or circumstances, in the environment or whatever, the person should go and try to tolerate it as much as they can, so that their mind gets the message that there's not danger in that situation.